This is the Patient Assessment Management Trauma Station. You'll have 10 minutes to complete this station. You have two ghost partners at your level of training that will correctly perform all your instructions. Perform all your assessment as you will with a real patient. All treatments should be verbalized. Do you have any questions?
No.
You are dispatched on a hit-and-run car-struck woman while walking. Per bystander, she won't talk.
BSI, is my scene safe?
Police have secured the scene.
Just one patient?
Yes.
Mechanism of injury is pedestrian versus car?
Yes.
You're going to have a partner provide C-spine. You're going to call for ALS backup. What's my general impression?
You have a 30-ish-year-old woman lying on the road with bloody clothing.
Okay. Does she react to my approach?
No.
Ma'am, can you hear me? Patient is responsive to verbal. Do I see any immediate obvious life threats?
Nothing immediate.
Okay. Is my airway up here patent?
Yes.
Okay. I'm going to check my breathing. I see bubbling blood with a sucking sound. What are my breath sounds on the side?
Right are diminished.
We're going to treat that as an immediate life threat and go ahead and have my other partner put a 3-sided occlusive dressing. Listen to my remaining lung fields.
Left is clear.
Okay. What's my rate and quality of breathing?
Shallow. And 32.
Okay, so we've got the seal on there. Put my oxygen at 15 liters a minute. The respiratory rate and depth don't improve. I'm going to have my partner go ahead and start bagging. I'm going to check my pulse.
128.
Are they equal?
Weak and regular.
Okay. Skin color, temp condition?
Pale, cool, clammy.
Any obvious bleeding?
No.
Okay. Patient shows signs of shock. We've already got oxygen in place. We're just going to keep her covered as much as possible while assessing. Not going to elevate the feet because of concerns for spinal injuries at this time. This is a high priority patient. Going to be load and go, hot transport, GCS of 10. I'm not able to get a patient history due to the patient's mental status. So I am going to go ahead and move into vitals with my partner. Blood pressure?
110/60.
Okay. And I'm going to just let a pulse ox take while I listen to breath sounds again.
Breath sounds have not changed. Still diminished on the right, clear on the left. Pulse ox is 95% on oxygen you have her on.
All right. I'm going to go ahead and start my head to toe secondary assessment then. Pupils?
Unequal.
Okay. Anything of note with the mouth or nose?
No.
And check behind the ears?
You see battle signs?
Okay. Any DCAT, BTLS, or blood when checking the head?
No.
All right. Tracheal deviation or JVD?
None.
I'm going to carefully check for step down or tenderness along the posterior.
None.
I'm going to go ahead and have my partner put a C collar on and continue manual stabilization. And I'm going to move on down to the chest. Any crepitus or DCAT, BTLS across the top?
No.
On the left lower?
No.
I'm going to defer palpation of the right lower due to a known open pneumothorax. Any change in breath sounds?
No. You hear a little bit more on the right as with the occlusive dressing, but still somewhat diminished.
So note some improvement on the pneumo. And then I'm going to move down to the stomach and all 4 quadrants.
No tenderness. No distension noted.
Patient is unable to tell me about pelvis pain, so I'm going to gently and slowly check for instability, stopping immediately if I feel movement or crepitus.
None. No crepitus.
Okay. Do I see any bleeding or any indication that I would need to check the perineum?
No.
Okay. Continue down the lower extremities, checking for DCAT, BTLS on either leg.
You haven't.
It's like an open tip of fracture on the right. That's non-life threatening, so we're going to ignore that for now. Do I have distal PMS?
Yes.
All right, distal sensation and pulse is noted. Motors unable to be obtained due to patient mental status. So just going to check the right upper arm. Anything of note?
None.
Pulse?
Felt.
Reaction to painful stimuli?
A little.
Okay. Same thing on left side. I see gross deformity of the left elbow.
Yeah, it is also locked at the elbow joint.
Okay. So I'm not going to palpate around that joint. I'm going to go on to the lower arm to have a pulse.
Yes.
Reaction to painful stimuli?
A little.
Any gross discoloration or evidence of compartment syndrome distal to that injury?
No.
Okay. We're going to log row the patient up for the spine board. While the patient is log rowed, I'm going to check the back for step down, tenderness, or decap BTLS. Anything of note?
Nothing noted.
So we'll log row the patient onto the spine board and transport at this time. Every 5 minutes, I'm going to complete a reassessment, repeating my primary, secondary assessment, and checking on my interventions. And I and my partners are going to address these two non-life-threatening injuries, splinting the leg and immobilizing this left arm.
Would you like to change any of your actions or choices?
No.
Okay.
Is that everything?
Yes.
Did I miss anything?
Nope.
Cool.